is an overview, and webinar 2 will involve the application of the best practices. And this second webinar will occur in 1 week at the same time. And as a reminder, you have been registered for both trainings, so you should get an announcement next week to join our second training. We're so very grateful for our presenter today, who joins us with a lot of knowledge and many years of experience. Dr. Linnea Plummer, who is a United States military veteran and the CEO of Onyx Therapy Group, an organization she founded in 2013. Dr. Plummer has over 15 years of experience working with a multitude of clients and specializing in the care of young women, the Black community, and members of the LGBTQ plus community. Grounded in the values of integrity and awareness, Dr. Plummer believes that emotional, spiritual, and cultural healing is attainable for all. As a researcher, she explores the experiences of Black women in clinical and supervision settings with the goal of creating a grounded theory that best suits the needs of Black women in a range of professions. And she is also an assistant professor lecturer at Johns Hopkins University. So without further ado, as you can see, we're in very good hands today. I'll turn it over to you, Dr. Plummer. Thank you again for all of your hard work here.
Thank you. Thank you. Thank you. Good afternoon, everyone. I am so excited to be here with you as we talk about assessments. So let's get into it. So again, like Ms. Dean Estelle mentioned, we are going to be talking about assessments, basically understanding a little bit about who we are, what we do, and how we do it. So our agenda for today is a welcome. I would do want you guys to absolutely use the chat just so that I could get to know a little bit about you a bit more. I like to incorporate that into the experiences that we have together. And for the rest of the time, we're also going to talk about how to loosen up the concept of assessment. Sometimes assessments seem very formal and they seem very time consuming and just a part or a task of a process, as opposed to something that we can actually use as a tool. We're also going to determine how we use assessments in our lives and then how we can apply some of that information to our clients. And then lastly, we're going to relearn and apply some new definitions of assessments, as well as exploring some different resources that you can use in the meantime. Like mentioned, we are going to do this particular webinar as an overview, and then next week, we're going to apply a lot more of this information. So just give me a second because I want to look at the chat and see a bit about who you all are too. Well, I guess I'm going to get some of that information in just a bit. So a little bit about me as you're using the chat. Again, I am the CEO of Onyx Therapy Group. We are a mental health company headquartered in Washington, D.C. However, we have 9 offices in 4 states, including Maryland, Pennsylvania, and Minnesota. I'm also a full-time faculty member at Johns Hopkins University, and one of the classes that I do teach is around appraisal and assessments. I've taught this particular class at Johns Hopkins, as well as another university that I worked at, Marymount University in Virginia. I am a veteran and I served in the United States Army for 8 years. And we use the assessment tool around mission first and people always. So I'm bringing up different elements of and identities and work experiences in my life because they all coincide with how I interact and engage and teach assessment, in that it's not always as formal as some of the documents that we have to complete, but it is really a matter of how we evaluate our own lives and our experiences and how we incorporate that to make decisions. My roots, who I am at the core is a therapist that works with children and families. That's how my career started. That's what I continue to love to do. In each of our locations, we have a playroom where we're dedicated to providing therapy to children and their families as well. I am a mom of 2 children, and I have real life intersections that are part of my experience and that are also used for assessment. So my real life intersections are my race and my gender, my social economic status, my education, my spirituality, and also being a proud member of the LGBT community as well. And then just as a joke here at the bottom, I am a Virgo, so I assess everything all the time. That's in case you guys are into astrology and the zodiac signs, you know, those good old Virgos, we are always finding something to assess and to look at as well. So again, extremely excited to be here with you all and to learn about you all as well. I'm seeing some information from you all. I see we have some directors here and we have some mental health therapists and family clinics. I'm so excited. Okay. Yes, we have some folks working in smaller towns here in New York and marriage and family therapists. This is going to be great. So feel free to use the chat as much as you want. It is a great way to build community with each other. It is a great way to interact and engage with me. And as I see different questions, those are going to be towards the end, but I do believe that our team is going to be tracking some of those questions so that I can answer them towards the end as well. But use the chat as much as you want. It makes me excited. Excuse me. All right, so one of our challenges, although it's kind of worded interesting, one of our challenges is that we are seeing that mental health problems affect about 10 to 20% of children and adolescents, but that in high income countries like the United States, those mental health issues are starting to decline. When I look at this particular quote for this research, what it means to me is that we are doing what we're supposed to be doing. As service providers, we are providing good quality mental health work for our clients and our families. And this is just another, to decrease that number, we can also use different types of assessments, right? To make it more streamlined. So we are on the right path in terms of reducing adolescent mental health issues, but it is because we are also working very diligently and working very hard, and using the assessments is just another added bonus. It is an additional tool to determine how to make good decisions and quality, effective treatment plans for our families and our children. So, again, when I think about assessments, especially back in the day, more in the past, and I think about assessments, it's always these formal assessments associated with a particular theory that has a document that we're listing out and we're answering these questions. But I want to think about, how do we use assessment in a day-to-day life, in our daily life, in our daily experience? What is something that you assess about yourself every day? So this is something for you to use the chat with, or for you to reflect on. So, and with this, I'm giving examples of, I like plants. So I assess the dirt of my indoor plants every day. Every day, I look at them, I touch them, I pay attention to the dirt, I pay attention to the light. That's a form of assessing, right? I'm gathering information so that I can make a decision. For those of us that enjoy cooking, and I didn't say I do, but some people do. But for people who enjoy cooking dinner or cooking at all, we assess our meat or our vegetables. Is it ripe? Is it good? Is it strong? Is the meat smelling how it's supposed to smell, or looking how it's supposed to smell? Again, we're gathering information so we can make a decision. Folks are also assessing their weight. They get up on the scale daily, weekly, monthly, but that is, again, gathering information so we can make a decision. And then even in this particular webinar, when you were trying to find your writing utensil, you may have picked out a pen and wrote with a little bit to see if it was still functioning. You are gathering information so that you can make a decision. So use the chat. Tell us about something that you assess with yourself today, or assess in your environment as it pertains to you specifically. And then what did you do? Because we gather information and then we make a decision. Okay, some folks are assessing their dog's weight. Yes, indeed. Absolutely. I love it. Yes. What am I going to eat? Absolutely. Yes, exactly. Again, does this outfit match? Assessing my energy level, and should I get coffee? assessing my stress levels and how to proceed with my anger, assessing the environment and if my child should take allergy medicine. Perfect, perfect, perfect. Assessing how I feel. So again, we're using this, we're going to normalize it in that assessment is really just a way of gathering information so you can make a decision. It does not have to be as formal as we've sometimes been taught. And sometimes if we think about it in such a formal way, we forget how effective it is and how much of a tool it is. When we think about it formally all the time, sometimes it becomes a task as opposed to a tool, right? So again, we're gathering information so we can make a decision. So in thinking quickly about how you learned to assess your life, did you learn to assess elements of your life in a traditional way based off of academics and processes, or in a social way through role modeling? Did you watch somebody and they taught you assessment, or did you learn assessments in general through books? How did you learn assessments? Yeah, socially, both, traditionally, absolutely, absolutely. And here's the thing with us as professionals, oftentimes when we engage with assessments, we are engaging with it primarily through the learned academic structure and forgetting that we assess socially as well. We assess by observation. We assess by using our senses. We assess in very socially engaged manners. So it doesn't just have to be formal. Again, we're gathering information so we can make decisions. So real quick, in terms of the root of how we assess and how we gather information is through two basic traditional theories. One is traditional learning theory, in which we receive, process, and retain knowledge. This is usually cognitive and emotional with some environmental influences. The major goal is to create knowledge and skills. Knowledge and skills. We also learn how to assess through social learning theory. And this is where we are, making large connections based off of observation and imitating others. And you may say, well, how does this really align with assessment? Well, it's really a matter of how we learn how to use assessment, how we engage with assessments. Do we engage with it very clinically, which is appropriate, or do we also add in other elements of our lives and our experiences so that we can assess the client and the family in a broader kind of way as well? Do we just use the forms, or are we assessing other elements of their experiences as well? Real quick, when you think of assessments, conducting assessments with the families and children that you work with, which step particularly is the most challenging for you? Is it selecting the assessment? I understand that some of our agencies require us to use certain assessments. Is it selecting the assessment? Is it the actual conducting of the assessment? So sitting with the client, sitting with the family. Is it evaluating the results? Is it reporting the results to the client and the family? Or is it integrating the results into the treatment plan? So what is the most challenging part for you when we think about assessments? Okay. Yeah, I see lots of 3s, some 5s, absolutely. Some 4s, all right. Okay, we're gonna talk a lot about, as an overview, we're going to be completing our addressing a lot of this as well. Absolutely. All right, let's go to the next one. Thank you for that information. So here we think about, excuse me, oh, I'm getting ahead of myself. So the purpose of assessments, again, is to collect information so that we can make a decision. So the easiest way for me, when I am working with my students at Hopkins or at Marymount, or even my supervisees at Onyx, and I'm teaching them about assessments, I teach them to use it through their five senses. We all remember our five senses, right? From elementary schools, what we see, what we hear, what we touch, what we feel, and what we smell, right? So if we keep in mind our five senses, easy to remember, just looking at our hand and remember each five, we could collect information by what we see. So again, we're thinking about when we're with our children, our clients that are children and families. We're collecting information by what we see them doing, and what we see that they are not doing, by how they are living in their homes, what is present and what is not present. We're collecting information about if we see a cross on the wall. What does that mean for their spirituality? Is that a protective factor, a coping mechanism, or just part of their normal structure? We're thinking about if they have a pet in the home, because is that part of responsibility? Is that part of additional tasks? How do they engage with that? So keep in mind that we're collecting information by what we see. We're collecting information by what we hear, right? So what is being said, but as professionals in mental health, we also know that we spend a lot of time paying attention to what is not said. When we have those pauses, those therapeutic silence, when they choose silence, what is not being said? That's another way we assess, we gather information by what we feel, our intuition. Oftentimes we're trained to be very clinical, which is important, but we also are humans living a human experience in this therapeutic alliance, and our intuition has a role as well. What are we experiencing in this moment? What are we feeling? What is happening? And using that as part of assessment too. Is it something tangible? Not always. But we are not always assessing on what is tangible. We're also assessing on relationship, especially with children and families, especially as we're looking at their attachment styles and how that shows up in different skills and experiences. And then, of course, we're also looking at we're also assessing based off of some of the traditional work around documentation and forms. However, you see in the order, I put that towards the end because I think it's really important that we also integrate all elements of ourselves when we're assessing and not just thinking about the documentation and the form. This is especially important when we are thinking about children and families through a cultural lens, specifically in that everybody doesn't give information in a very standard or tradition, what we call standard or traditional in the United States. They may not tell us, but they may show us in their body language. So we have to be paying attention. They may be showing us in their tone or giving us information through their tone. They may be giving us information through inflection of particular words or pauses. Again, we have to be able to gather information, especially with our culturally diverse clients, in the ways of which they give information, not in the ways that we receive it, but in the ways that they choose to give it. With that collecting of information, we then make a decision. So that is the purpose of assessments, just to collect information so we can make a decision. Those decisions may be how to incorporate the assessment results into treatment plans, how to make SMART goals that are both measurable and time-oriented, how to choose interventions that we should be using with our families, and how to forecast success and progress. Again, that was a lot of information. So at any point, if you have any questions, feel free to drop it in the chat and I can answer those questions for you as well. So this is just a little bit of research, right? Because I'm sure some of you guys are a little bit nerdy like myself and you want some research behind some of this information. So I just pulled out a couple research articles and some citation here, just so that you can have a point of reference. These articles were amazing. I reread some of these articles over the last couple of weeks in preparation for today, but really thinking about, again, how assessments are really about collecting and analyzing information so that we can make recommendations and intervention, or how we collect information and assessments so that we can assist with depression and anxiety and burnout and other stressors, or how we use this assessments so that we can transfer the responsibility to the client. You know, we really want our clients to take ownership. And the more information we gather from them, the more we can say, this is what you gave me. And now let us work together. You involved in the process, so how we can help with this as well. We recognize this particular author, Childs, and his crew of researchers spoke specifically about folks that are child serving professionals who use assessments showed improvements in their own confidence, their knowledge, and their preparedness. So what this article was about specifically was that if we as professionals use the assessments consistently, we start to feel confident. We start to feel more knowledgeable. We feel more prepared. And when we feel confident, knowledgeable, and prepared, we always show up and we're in a better position to serve our clients. So interesting to think about how we improve our confidence, our knowledge, and our preparedness by using assessments, primarily because it gives us the language to use, it gives us a direction to use, it's clear information of which we can incorporate it into treatment plans and how we can report that information back to our families as well. If you have any thoughts about that particular quote, feel free to drop it into the chat as well. Your experience with assessments, does it increase your confidence, your knowledge, and your preparedness as you work with clients? Again, the nerdy part of me, right, loves talking about ethics, but the ethics are the root, the foundation of our field. And so I pulled up a couple ethical codes from both the American Council on Association and the National Association of Social Workers that explicitly talk about how we are to use assessments in our work. And again, this is just a bit of information. You guys will get the slides as a point of reference as well. But again, focusing on assessments being a place where we gather information so that we can make a decision. That's it. We're just gathering information to make a decision. Very direct and straightforward. And again, we gather that information through using those 5 senses that we talked about before. Here, I brought in multiculturalism as a place of assessments, specifically because it's important that we assess not just based on the forms that we are given, but we assess based on the age of our clients, the race and gender of our clients, the culture of our clients, the disability and the language preference, their religion, their spirituality, their sexual orientation, and their social economic status. All of that has to be considered when we do an assessment. And you may say, well, Dr. Plummer, I don't know how to do all of that sometimes. I don't know how to incorporate all of that because I just have this one form. Well, remember that form that you use, that formal assessment, is just one way that you assess. You can also assess through what you hear, what you see, what you're experiencing with the client, and bringing that to the forefront so that your treatment goals and your interventions are not just based off of a paper document that has been researched, yes, and applied for validity and reliability, but also based off looking at your client holistically, because that is how we integrate our cultural competency into our work with assessments. So here are just a few more ethical codes when working with families, understanding our own boundaries of competence, making sure, I love this particular one, 5.02I for the National Association of Social Workers, in that social workers take the appropriate steps to ensure that the participants have access to appropriate support services. So we use that assessment to make a decision. And sometimes that decision means that we're referring them to different supportive services. But we can only do that if we truly understand who our client is through the lens of gathering information. All right, so for those of us that are visual learners, I put some blocks here. It might look like a Jenga, if you will, but some blocks. So again, why do we conduct assessments? Why do we conduct assessments? So the visual is for our visual learners who like the step-by-step process. But the question is here, why do we conduct assessments? Please use your chat and tell me what you've learned so far about why we use assessments. Yeah. Great question, Heidi. I'll answer that question towards the end around how do you assess when something is not being said? Yes, 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 we absolutely, yes. So we're caring for the client, we're getting to know the client, we're gathering information so that we can make decisions with them. Absolutely, absolutely. And there's so many ways. Really quick, tell me a couple of the ways that we can gather information, the ways that we can assess aside from our formal forms. What are other ways that we assess? Yes, through conversation. Yeah, open-ended questions, body language, observation, active listening. Yes, gut feelings. Yes, that's that intuition. Absolutely. Intake, collateral information. I love it. Absolutely. You guys are on point. I love it. Thank you. All right. So when we're thinking about and could continue to drop information, yes, thank you, Yolanda. We're using our five senses. When we're thinking about assessment topics specifically for children and families, as folks, we've often been taught to assess for a diagnosis. But again, we are gathering information to come up with decisions, to come up with treatment plans, support services, recommendations, interventions. So when we are assessing for more than whatever information may yield a diagnostic code. We are assessing for how does the family communicate with each other. We are assessing for what is a parent's parenting style and how does that impact the child and how they interact with others, which then means we're also assessing for attachment styles. We're assessing for personality. Who are these folks? How do they engage with themselves and how do they engage with others? We are assessing to see if there's been community violence, because community violence, as we know, is associated with adverse childhood experiences. So is there community violence? Is there violence in the home? Is there violence towards self? We're assessing for family dynamics. How does everybody engage with each other? You may remember from some of your classes around family systems and the looping cycles and the roles that people play. How do we engage with each other? And what happens if we no longer want to be in that role? What happens if the client doesn't want to be in that role anymore? And they're not acting out because they have oppositional defiant disorder, but maybe they're acting out because they want to be outside of that particular role. And they're getting resistance from their family. What are the family dynamics? Of course, we're also assessing in more traditional ways around family history, of which we're looking at past psychiatric hospitalizations or diagnosis, or even the impact of psychotropic medication during pregnancy. So we're looking at family history, yes. Here you may say, and Dr. Plummer, why did you include infertility and fertility? Well, my experiences have taught me that when a child has, when a parent or a set of parents have struggled a bit with pregnancy, they interact with that child a bit differently. It's a bit more cautious, and they're more cautious around saying that something is wrong that needs to be addressed, and they make excuses for it. I'll give a quick example. So I stay on the ground, even though I'm the CEO, I stay on the ground because I love the actual clinical side of mental health. And so I work with a school in DC. And one of the children, they kept telling me this child has oppositional defiant disorder. She's showing all the symptoms, right? You know how the schools call you in and they say, you know, they already want to tell us what is going on. And I said, okay, I appreciate all this information. If I could have some time with the family, if I could go through a bit of assessments, if I could observe in the classroom and observe in the home, right? Because it's important for me to be in the home environment to see where there is consistency, but where there might also be some disconnect. And And while in the home, I was assessing through what I was seeing and what I was not seeing around the child's interactions with the parents. And so at one point, after the observation period, I went into an interview period, and it wasn't a traditional interview with a form. It was me taking my intuition, taking what I saw and heard and what I didn't see and hear, and then forming questions there on the spot. And one of the questions I asked was around fertility and what happened, like if there were any fertility concerns or issues. And at the time, and at that point, the family then disclosed what they had not ever disclosed to the school, which was that the child had been adopted. And prior to the adoption with the family, the child was in a very traumatic what they were referring to as an orphanage. And that is where her first years of life were, which then made me think, maybe this isn't oppositional defiant. It could be a trauma response. It could be something else. As I continued to assess around the situation, I ended up determining that the child had reactive attachment disorder. Had I treated the child on oppositional defiant disorder, the treatments and the interventions would have been totally different than if I treated the child with reactive attachment disorder. Two totally different types of disorders, right? Two different totally types of roots, and two different total types of ways that the family should engage with the child. Excuse me. As soon as we started engaging with the child and treating the child for reactive attachment disorder, we saw a shift in the behaviors. All of that came from the question around fertility and infertility. So when we're looking at family and assessing children and families, we have to be able to assess on a wide range, not just what we think is happening, not just on what they're saying the presenting issue is, but let's use our five senses and really explore what is happening in the situation and what other possible factors could be in place. So now I'm happy to report that student is doing extremely well. Her family has the tools and the techniques to feel successful with her, and the school also feels more equipped to handle some of her concerns around attachment. Again, if you have any thoughts about that, please drop it in the chat. I'd love to talk to you guys about it as well. So when we're thinking about those five senses, we're also thinking about the different types of assessments. Like you all mentioned in the chat, there's some assessments that are very informal. This is conversation. These are anecdotal notes. And those anecdotal notes are based off of what we see, what we hear, what we don't hear, what we don't see, as well as our intuition, right? That's where we get to have that, the old SOAP notes and the DAP notes. That assessment piece, that analysis piece includes the opportunity for us to talk about what we felt in the session, and not feeling like we felt sad, but what other things arose for us. So even when we are writing our notes, our SOAP notes and our DAP notes, we are constantly using that A to assess what was happening in the session as well. And then worksheets that are informal. Semi-informal would be questionnaires and interviews and mental status exams, which we should be doing quite frequently with our families as well. And then formal assessments. Those are the ones that we were also often taught in our technical schools and our graduate schools, et cetera. So here are a couple review of some formal assessments. I'm not going to go through all of them. Again, you all will be getting the slides. These are the assessments that we use often in Onyx, and I encourage my students at Hopkins to use as well when we're working with children and families. So we're looking at adjustment. We're looking at family adaptability, right? When you're thinking about adjustment disorders, you have to think, how did the family adapt to certain experiences? How do they adapt to loss? How do they adapt to change? How do they adapt to newness, right? Because the family and children may not have a traditional mental health disorder. It may be that they just don't have the skills for adapting. They don't have skills around resilience, and if we treat it as if it's a family systems issue, as opposed to a skill deficit issue, we might miss the mark. So we really want to assess broadly and then narrow. In terms of assessing broadly, we want to try to use broadband assessments and then narrow it down, not assessing just based off of the presenting issue, but going up broader and then narrowing it down. These are different ways that we can do that, such as the McMaster approach, which will give us a more broadband experience. A couple more assessments. These are mostly based off of parenting and marriage satisfaction, because there is a relationship, a correlation between marital satisfaction and a child's behavior, and not just based off of what the parents are saying to the children about marriage, but also the energy that is in the home environment. Also the ways that they look at each other and the language that they're hearing in that home environment. Those modeling, because we're talking about social learning, that modeling also determines how the child will interact with self and interact with others as well. I wonder if there's any of these assessments that seem new to you. If so, drop it in the chat as well. Here's some informal assessments. Again, you all are going to get these slides, and I'm really excited about it because I really want you to go and check out some of these informal assessments that specifically look at implications for families and for children as well. Absolutely. Absolutely. Yes, thank you. All right, I pulled out a couple assessments that are considered formal assessments, but they have such a natural conversational element to them that I really wanted us to think about them really quickly. So genograms. Genograms are those family trees that we outline information about the family and their relationship. They're usually done over 3 generations, and they help identify dynamics and patterns. I love this particular assessment, and I use it for children and parents and adults separately as well, because so much of our learning is also based off of this social learning theory, how we interact with people and what we learn through modeling, which is what we're assessing, right? We're assessing what is the children seeing? What are the things the children are seeing? What are the things that the parents have seen? What are their experiences? Because that forms identity and that forms skill development. So it's always wonderful for me to do genograms, because when you're asking the client about themselves or about another person in their family or about the generation, you're paying attention to what they are saying, right? Oh, that person always comes with me to my soccer games. Oh, my mom reads books to me at night. But then you're also hearing what they are not saying. Are they excluding something that has to do with nurturing? Are they excluding something that has to do with connectedness? Are they excluding something that has to do with routines and structures, of which we know children tend to really thrive in because it allows for predictability and it decreases anxious tendencies and behaviors? So here we're looking at what the child is saying as they're describing the people in their family and what they're saying when they are describing the dynamics, but we are also thinking about what they are not saying. What are elements that we know is important for a child to have in their life or a family system to have, but people are not talking about specifically? I also love genograms because it allows for creativity and art. You know, sometimes we're making actual family trees, or sometimes we're making maps, but oftentimes it allows the clients to use their hands. And we know the importance of that eye-hand coordination when it comes to mental health and how it pushes the client out of their limbic system and to their frontal lobe, so they're thinking more logically. So it's helping them narrow and put their feelings on a journey to thought and then to application. So again, genograms are wonderful because it involves observation, it involves our ability to hear, it involves them being able to be creative and using their hands, and it is fun. It's fun to create a genogram. I saw that somebody said they work in schools, and so they use genograms often as well. And it is great, and it's very resourceful because all you need is a piece of paper and a pencil, and you can do it virtually as well because you're talking your client through it. So another one that I love is family sculpting. And this one is where we're actually assessing the roles in the family. So who are you? What is your role? Are you the person who always feels like the victim? Are you the person that also always feels like the leader? Are you the person that feels unseen or extra seen, like there's a microscope on you? Who are you, and how does that role play a role in your life and your interaction with your family? So you are actually sculpting. If we have the opportunity to be in sessions in front of our clients, both children and family, we may give them Play-Doh. We may give them something to mold, which allows for that sensory experience as well. And then they're talking to us. Again, if we go into that research around that eye hand coordination in therapy, we recognize that clients tend to talk more when they are using their hands to do something, which is why we allow them to do a lot of art. And we want them to be creative and coloring. And when they're using their hands, they tend to talk a lot more. So family sculpting is another assessment that you can use to gather information so that you can make a decision. How the results are communicated, I think that was step number 4 in that questions of what are some of the concerns that you have. We recognize that the results are communicated generally with, if we can, it should be with the clients together. Now, if your client is an adolescent, we understand that there's some legality behind the fact that the results don't always have to be communicated with the family. So if you happen to be working with an adolescent and you're giving them the results, you want to also help them understand the results so that they could give it to their families. So after you're giving the results and you're giving them time to process it, you also want to give them some skills, some language, some vocabulary, so that they can communicate this to their families as well. When we're communicating assessment results, we often give it at the beginning of the session so that we give the rest of the session for processing time, for skill development time, for questioning, etc. Shortly after I give assessment results, I usually have my client with something in their hands, a clipboard, a piece of paper, something that they can doodle and they can jot. It tends to help with the processing. For my young clients, they may have a coloring sheet or something with them as well. But when we give the information at the beginning of the session, we give them time to process, to talk, and to create a plan around what they want to do. I encourage a lot of structure in the results meeting, in that this is what we're going to talk about, how we're going to talk about it, this is the time we're going to use the process, this is the next step, just because sometimes assessment results can be a little jolting, and that causes people to get unregulated. So the structure of the meeting encourages the regulation to come back into place. Again, through modeling and parallel processing, we know that when we have more structure, then people have more predictability and tend to feel safer. Here we also have in communicating the results, I also have homework that I use with the clients. So I'll give them a specific homework assignment and I'll remind them of the boundaries. Our next session is usually the next week or 2 weeks at the max, because I don't like too much time space in between in case they're processing, again, these results differently. Remember that it's important to communicate the results with a lot of empathy. Oftentimes we get very clinical, like this is what is happening and how, but this is how we give information, and we should communicate results through our human essence and human experience, understanding the power of rapport building, and that when people are getting more information about who they are, our vocabulary about who they are labeling some of their experiences, they need that to be done in a very human experience, a human essence kind of way, with lots of empathy, with care, with pauses, with time to process. Again, here are just some quick ways of which how we can use assessments in terms of case conceptualization. We're going to talk about this a bit more next week when we think about best practices and implementation. But I did want to bring it up here that assessments tie in strongly to case conceptualization. We are gathering information around the client's problems, around their triggers, around the origins of those problems. But, and as important, we are gathering information around their strengths, their protective factors, and their coping mechanisms. So we are, as mental health people, we are wellness driven, not deficit driven. So we are looking at where those strengths are so that we can incorporate that into the decision-making process as well. And of course, we know assessments and treatment planning. On this particular slide, each element of the SMART goals I have tied into assessment. So when we're thinking about specific as a goal, we're using direct language from the assessment. That is how we are specific. When we're thinking about realistic, we're thinking about assessments that include the environment. We have to make the assessment, the goal, realistic for the client. Is this something they can actually achieve based off of their environment? Again, we'll go into more depth with this next week. This is more of an overview today, but I did want to make a connection here for you in terms of explicitly how we use assessments when we are developing those treatment goals. What are the specific things we are looking for in those assessments as we write those goals? So your takeaways, can you believe it's already been over 45 minutes? Time flies when you're having fun, right? So our takeaways in terms of assessing, we assess to gain information to make decisions. We assess based off of forecasts for growth and development. We assess based on compatibility of interventions for the client as a holistic person. We are assessing to determine how to develop our case conceptualization and how to build our treatment plan. For those of us that are directly in core agencies or in schools, we may also be assessing to investigate allegations of abuse or information for court proceedings. But generally, we assess to gain information so that we can make a decision. We assess so that we can gain information to make a decision. All right, a couple implications for you. Like that quote said earlier on in the presentation, when we use assessments as professionals, we tend to feel more confident. We tend to feel more knowledgeable. We tend to feel more prepared, and that increases our satisfaction in our work and our reputation within our careers. We also use assessments so that we remain ethically competent. So we covered some of those ethics. We also use assessments so that we have balance and we have ways that we can build rapport with our clients. We use our assessments so that we can make individual referrals for our clients and reasonable and measurable interventions based off of who they are, and also so that we have strong documentation, which is part of our ethical responsibilities as well. So again, the assessments is for us to gather information with our clients so that we can, and I say with our clients because they learn about themselves as they are doing their assessments as well. We learn with them so that we can make decisions with or for them, depending on the type of work that we're doing. But we also use assessments for our own work satisfaction, for our own professional development, for our own reputation and career, because there are implications for that as well. Here are some additional resources. And again, you guys are going to get the slides. I really want you guys to look into these additional resources. Specifically, before our next webinar next week, I'd love for you to watch that TED Talk on social justice, why students should have mental health days. That is going to be extremely important. Here are also a couple of child and family assessments that I would love for you to look at, especially that Ohio Scales Worker. That is a very simple but broadband assessment. Once you get into it, you'll see that it is assessing for a number of different things, a number of different issues, and then based off of the score, we will go ahead and determine what other assessments need to be used next. I understand that everybody doesn't have the flexibility of selecting their primary assessments. But again, because we are assessing through those 5 senses, we can find ways to incorporate information, incorporate other information gathering processes as well. So please, as your takeaway, or as your homework rather, look at that TED Talk, as well as pull up the Ohio Scales Worker Edition, which is generally free online in a PDF version. So next steps, we are going to be talking about best practices and application. Same time, same day, different date. We are on May 13th next week, but it is a Thursday, same time at 12 o'clock. So here is an opportunity for us to answer any questions that came up in the chat box.
Thank you so much, Dr. Plummer. That was amazing. Thank you so much.
Thank
Yes,
you.
we did have a few questions that came up, and I'm bringing those up right now. One question that you saw early on was when assessing when something is not said. What do you do? Do you just say like a question was asked and the client did not provide a straight answer, or the client ignored the question and changed the topic? How do you handle that situation? What's your advice there?
Yes, absolutely. You take note that the question was not fully answered. And why that is important is because it could not be answered because the client is avoiding. It could not be answered because the client doesn't understand it, right? It could be not answered because there's a cultural difference. And so that's not how they would have framed it or processed it. It could also be not answered because there's a comprehension issue in a more formal disability kind of driven way, like a receptive language issue. So if a question is asked very directly and they're not answering it, we just take note to it so that we could analyze that a little bit later. But we do not pressure the client to answer the question. That would be inappropriate and it tears on interrogation. We just take note that they didn't answer it. What I also mean by that is that it's not just about whether we asked the question and they didn't answer the question directly. It is that we asked the question and how did they answer it? Specifically looking at families and children, if we're asking a question related to attachment styles and they don't answer based off of attachment styles, we then get to wonder, what is their attachment style? Do they connect to someone? Do they know that it is okay to connect to someone, that it is safe to connect to someone? So we're listening for what they're saying explicitly, but also where some of those things that we might have predicted that they would say or that would be appropriate for them to say, and they did not say it. What is the meaning behind that? That is the analytical piece of being a mental health provider, analyzing what is happening.
Mm-hmm. Great. Thank you so much.
Yeah.
And I just want to chat into everyone. You know, we have a special opportunity here because we're going to have Dr. Plummer next week. What do you hope we cover next week? What do you, if there's one thing around application, because I love the chat question that you asked around what is most challenging, right? And we had a variety of answers, a lot of number 5s I saw.
Yeah.
So I'd love to hear from the audience because there really aren't any other questions. I would love to hear from our audience about what you hope we do next week. What would be most helpful for you? Obviously, Dr. Plummer has, outline and cover, but I would love to hear from you. So chat in. Maybe one thing we hope we get to next week, or what would be most helpful around assessment. And then I think there is a little conversation around, reassessing so that assessment doesn't happen just once, right?
Right.
That is
So
something to participate in.
Mm-hmm. Absolutely. So my, in terms of best practices, which we'll be talking about more in depth next week, it is important to assess in those first few sessions. That first assessment may be something formal like an intake. That second session may require a couple more formal assessments. In Onyx, we don't go that route. We are very much more culturally responsive in that the folks that we tend to serve are people who are storytellers, people who may share experiences. And going through a checklist can be a turnoff. It's a very westernized approach to gathering information. Instead, let's just talk. Tell me about who you are. Tell me about what you want to know. But we use those first few sessions to gather information for our case conceptualization, which then transfers over into our SMART goals on our treatment plan. In Onyx, we review our treatment plan and our data collection every 6 months, just to make sure that we are still on point with our clients. So again, they may not get a formal assessment every 6 months, but we will engage and re-engage in an assessment process where we're gathering more information in different types of ways. And then again, we review it again every 6 months. That way, we are staying present with our clients' growth and their strengths and their protective factors and their coping mechanism. And we get to use that information, especially if we're doing anything that's quantitative. We get to use that to say, hey, look at the progress you've made. Look at what you told me in February and now what you are telling me in August. Look at yourself and what you are doing. And that tends to help people who are quantitative driven. Qualitative experiences, we collect that information as well. And we say, hey, this is what we talked about in March. And now this is what we're talking about in September and October. So we should be reassessing as a best practice at least every 6 months.
Thank you.
You're welcome.
One last question. Somebody was asking about your thoughts around virtual assessment.
Oh man, this pandemic has really been a thing for us, hasn't it? We don't get to assess the same ways that we used to. One of the biggest things it took away from us is assessing energy, right? But because you can't always feel your client, and that is important when we're thinking about how we assess on those 5 senses specifically related to intuition. My thoughts is, if you can't tell, I'm an extrovert. I love being with people and in front of people, so I don't necessarily like virtual assessments. However, it is what we are required to do right now. So we do the best that we can to make it creative. For my children that I work with, I ask their parents ahead of time for permission, but I generally have them walk around with whatever their device is. Oh, you are on your tablet today? Walk me around the house. Flip your camera and let me see what's going on. Show me your favorite thing in your house. Show me your animal. Show me your room. Show me whatever, right? And I am looking for what they are showing me and also what I do not see. When we are assessing with adults in the caretakers, again, I explained the limitations to being virtual and how I wish that the situation could be different, but what I also need to see from them. So I might ask them to angle their camera a little bit differently and things like that as well. So making some accommodations there, but being very transparent that this is not the traditional way that I prefer to talk with them. I also don't call it assessments. I never say I'm going to assess you today or we're going to do this assessment. I say I just want to talk about some things, I just want to get to know you in a different kind of way. Make it a little bit more normal for them, especially people who've had poor experiences with the health industry or with services that have been controversial for them as well.
Thank you. Fantastic.
Yeah.
Okay, we're collecting some of the things that people hope to learn next week, so we'll pass those along. If you want to move to the next slide.
Yeah.
We have, you gave everyone your contact information, and this is just a few of our upcoming events, everyone. As we know, part 2 next week. And then we have an event called Connecting with Caregivers, Supporting Parents of Children with Serious Mental Health Outcomes. That's also a 2-part webinar series on May 12th and May 19th. And of course, if you have any questions for us, you can email us at, if you go to the next slide, ctac.info@nyu.edu, I believe.
Well, let me see. Hold on. There we go.
There we go. Great. So thank you again, Dr. Plummer. We look forward to next week. We appreciate your time and energy, and here's some information for you to stay in touch with Dr. Plummer, and we'll see you next week.
I appreciate you all. Have a good day. Have a good day. And think about how you assess yourself in your life, right?
Great.
Absolutely. Thank you.
Take care, everyone. Bye-bye.
Bye.